As our active duty members come back from the wars, and remember we've had 2.5 million service members, soldiers, Marines, sailors deploy to Iraq and Afghanistan. As they come back, initially their care will be, in the United States at least, in the military health system. But they're going to be generally getting out of the military, leaving, retiring, and they'll go either to the Veterans Administration or the civilian world. And there's a misconception. Many people think that all veterans go to the Veterans Health Administration. That's not true. About half of them go there, but many, even of that half, get their care either or both in the civilian sector and the VA. So it's especially important for civilian providers to learn about some of these issues, PTSD, traumatic brain injury, but also the more severe wounds. First of all, you need to ask, have you served in the military? And then as part of the serving in the military, where have you served? What was your job? What's your rank? Were you exposed to blasts? Were you exposed to other agents that might have caused issues? And then, of course, to ask about sexual health and functioning. There have been enormous advances in medicine, in surgery, specifically in the area of treatment of service members with amputations or genitourinary injuries. So in the area of lower extremity amputations, the advances in prosthetics are amazing. And just the understanding about what it's like to go from being wounded and having that amputation to having a prosthetic fitted with the issues around the socket. There was a great talk here by Dr. Pasquina, who is in charge of physical medicine and rehabilitation at Walter Reed. And then how do you teach somebody to walk again? If they're a triple amputee, which many of our service members are, how do you restore the quality of life? And along with the advances in prosthetics, we've made advances in pain management, although not enough. And we really need to learn more about how to manage chronic pain with less dependence on opioids. The military is a leader in this area, and there's a variety of different modalities from yoga, acupuncture, stellate ganglion block, and a holistic approach. We know, for example, that problems with sleep and anxiety exacerbate pain, so part of the treatment of pain has to be a multidisciplinary approach that helps reduce anxiety. Another piece that's really important is continuing to engage the patient, because social isolation, and people often do want to withdraw when they're in pain, social isolation really contributes to the problem. So it's critically important that the treatment team engage the patient, not just around things like mental health counseling, but about sports and recreation. The military is doing a lot with adaptive sports, and also more now actually in the creative arts, because not everybody likes sports. One of the things that's very important is to have a cohort of wounded soldiers who can work together, inspire each other, motivate each other.